Rainier School in Buckley, Washington, is a residential school for the mentally retarded. In this setting, a research program is going on which aims to teach retarded children academic subjects using the reinforcement principles and behavior modification you have just seen applied to psychotic children. The program was initiated by Dr. Sidney Bijou, a psychologist, with a research staff consisting of Dr. J. Bernbrower, whom you see here, Mr. John Kidder, and Miss Cecilia Tague. Dr. Bernbrower, what do most of our institutions do to teach the mentally retarded?
Most institutions have a fairly large educational program, which is run along traditional classroom techniques with some variations designed for the retarded. Unfortunately, the success of these programs has not been what most people would have hoped for.
How did you approach teaching mentally retarded children?
In designing a teaching program for the retarded child, first of all, I would, and we did, discount the traditional preconceptions of what a retarded child can and cannot do, or what he can learn or cannot learn. What we teach are pretty ordinary things, reading, writing, and arithmetic at the primary level.
What's different about the way you teach these things?
The two major characteristics of the teaching program are first that we treat each child as an individual and prepare instruction for him in a stepwise fashion that will take him at pace that he can absorb. And secondly, we use reinforcers that are meaningful to the child, and we dispense them meaningfully. We use candy, toys, and other goodies that most children like. To get these, however, they have to earn marks. These are tokens for achievement. The children really look forward to their classes. Once inside, they quickly get ready to start the day's work. The advanced group begins by picking up folders containing a series of lessons to be completed during the session. Since the lessons are individually designed, each child can work at his own speed. Each of them keeps a daily log of his work, first writing his name on it, and then setting his watch by the wall clock. Incidentally, the children are very proud of their watches, which they have earned by learning to tell time. Now each child demonstrates and maintains his ability to read a clock by writing his exact starting time on the daily log sheet. Ron is working with a stimulus presenting device which allows us to present new words to him in a systematic way. This is the sight vocabulary part of the reading program. For each correct response, he gets immediate reinforcement from his teacher. He has a very good attention span now and makes few mistakes. One of the boys, whose IQ is only 45, is learning 6 new words a day with this procedure. Mary is a Mongoloid child and the youngest in our program. She is doing a picture phrase exercise to maintain the vocabulary she has learned in the sight vocabulary program. We're pleased to see Mary working steadily on her own. Over a period of several months, she has been taught to do so. Since children in the beginning group are only assigned one task at a time, the teacher will look over Mary's work as soon as she is finished and give her marks for correct responses. Mary knows that she can exchange a page of these marks for a reward after the class is over. Jimmy is learning to follow written directions. He is a step ahead of Mary in reading skills. During each sight vocabulary session, Jimmy learns 2 new words, and here puts them to use in a practical way. This is truly meaningful reading. His concentration on his work is remarkable for a boy who can't keep his mind on anything for too long outside the classroom.
in box 6 put 4 green cars and 2 blue.
Arnold is wrestling with arithmetic. Before he entered the program, it was extremely difficult for him. But because we encouraged him to use his environment, including his fingers, he can now do addition and subtraction very well. This is Lee, one of our advanced students. He has progressed to the point where he can study sight vocabulary entirely on his own. This stimulus presenting device is considerably more sophisticated than the one Ron was using earlier.
He is big, but she is little.
He is big, but she is little.
Drink all the milk.
Drink all the milk. At the end of the school day, all of the work is marked. Okay, Lee, you ready to trade?
Yeah.
Give me the page. Okay, Hugh, you all ready to trade?
Yeah, what do we get?
Let me have a page.
Well,
What do you see in there?
I think I'll have my job for today.
All right.
They take together. See ya.
Bye.
Y'all ready to trade? Got a full page today? Good girl. What would you like? What looks good? Okay, that's fine. See you tomorrow.
The rewards of learning can be enjoyed by anyone. The staff is just as pleased with Mary's progress as she is with her candy.
At Patton State Hospital in California's San Bernardino Valley, a reinforcement therapy program has been set up to help long-term chronic psychotic patients. It is patterned on the pioneer work of Dr. Ted Ione, the first to apply reinforcement theory to the treatment of mental illness. Dr. Otto Garricky, superintendent and medical director of Patton, was instrumental in getting the program underway.
As Dr. Simmons said earlier, one of the problems facing the staff of any mental hospital is the sizable group of patients who don't seem to respond to any of the various forms of therapy the hospital has to offer. Here at Patton, some of these treatment failures, as we call them, have been in the hospital anywhere from 6 months to 30 years.
What led you to try reinforcement therapy with these patients?
Yes, we felt that this type of therapy has two obvious advantages. First of all, it deals with the patient's immediate problem, the behavior which causes the community to reject him. Secondly, the principles of reinforcement therapy are relatively easily learned by the nurses and technicians who must apply them daily on the ward.
Reinforcement therapy does require special training for ward personnel, doesn't it, Doctor?
Yes, it does, but its practical aspects are relatively easy to grasp compared to the traditional psychodynamic techniques. Dr. Hal Schaefer, one of our research psychologists, gives a 6-month course in reinforcement therapy techniques for nurses and technicians. We find that after completing the course, these people can make a significant contribution to the patient's improvement.
One of the people now working with reinforcement techniques is Nurse Dovey Farish, who supervises Women's Unit 10.
I've been working at this hospital for 11 years in psychiatric nursing, and in the past I've found that our programs, we thought they were good programs, but there's been something missing we tried to do everything for the patients. They had no part in their own treatment. I think the patients know that we care about them. We don't tolerate inappropriate behavior. We try to help them change this behavior and try to guide them. But they soon find out that this is a chance for them to get up and get out of the hospital. And many of them had given up hopes of leaving the hospital.
En mi huerto brilló la esperanza que alumbra el camino de mi soledad.
On Unit 10, most of our patients have been in the hospital for several years. But now that we are rewarding them for improving their behavior, we are seeing some real changes. Instead of sitting off in a corner somewhere or pacing up and down all day like they used to, some of our patients help out with the ward work. Of course, improvement in behavior is not unique to our program. The essential thing is our systematic use of reinforcement principles to bring out and reinforce appropriate behavior. There are many types of behavior which these patients will have to learn if they are to live successfully outside the hospital. As part of our program, improved behavior is rewarded with poker tips. We call them tokens, and the patients use them as money to pay for their room and board as well as for the various ward privileges. Some appropriate behavior is rewarded immediately, but patients also get some of the tokens they have earned at a regular pay call. Because we encourage the patients to think for themselves, they are asked to explain what they have done to earn their pay.
And I told Gladys Conroy that I lost my call.
And you get paid for socializing.
Yeah.
See, you overpaid me.
I did?
Yeah.
How much did I overpay you?
Well, let's see. I got 119 and you gave me 112. Let's see. You gave me I gave her 112 and I've got 10, 20, 30, 40, 50. Yeah, that's how much you gave me over.
This patient was deliberately overpaid. She'll get to keep the extra tokens as a reward for figuring it out.
Will that help you out any?
Sure.
Some patients spend their tokens at our vanity shop. They enjoy their beauty treatment and later they will be rewarded for looking nice. This helps them to learn that keeping neat and attractive is a good thing. Everyone pays to go into the dining room at mealtime, and they are seated according to their progress in acquiring acceptable social behavior. Some eat at comfortable tables with tablecloths and flowers. Others have to accept much less elegant conditions until they earn the right to eat at a better table.
2 tokens. I earned 2 tokens this morning.
Well, where are they?
I don't know.
Well, I can't let you in for lunch without tokens.
Here's the cherry pie.
2 tokens.
I don't have 2 tokens.
Yes, they do have cherry pie for lunch. It has whipped cream on it.
Oh, give me some.
2 tokens, Sally.
Let me in there.
How much do you pay
Let
for your
me in
meal?
there.
How much do you pay for your
Let
meal?
me in.
How much do you pay for your meal?
2.
2. Well, where's the other token?
I haven't got it.
Well, you better get one.
Oh.
Come on, Nellie. Go on, Nellie. Sit down. I'll have to charge you for that. I'll charge you for every time you hit me.
I haven't got 2 tokens.
Well, why don't you go get some tokens? Have you sat around all morning not done anything to earn tokens?
Yes.
Well, that's too bad. You'll have to go without your lunch.
Well, take that one, please.
You know what? You do something to me. Round. And I'm not kidding. Play around. That's it. Come on. Get it going. The other way. Reverse it.
These patients are watching Jacqueline Lane's daily exercise show. If they exercise along with the program, they get reinforced immediately, especially if they're overweight.
Slow down slowly.
There's Ellie. She's making sure she won't miss her supper, too.
Inhale. Slow down. Like waist in this time. Stand tall. Inhale. Exhale.
Hi, Ellie. Do you know what that's for?
No.
Well, it looks to me like you're reading.
A patient who takes an interest in what's going on in the world will have an easier time when she leaves the hospital.
Ruthie, you can't sleep in the bed tonight. You didn't have enough tokens to pay for it, so you have to sleep on the cot here.
No.
Ruthie, you don't have enough tokens to earn the bed tonight. You have to sleep on the cot.
Yes, I do.
Let's get up and get on the cot, Ruthie. You can't sleep in the bed tonight.
Yes, I do too.
You don't have enough tokens.
Yes, I have enough.
Let's get up, Ruthie. You don't have enough tokens for
I
the
do
bed.
still have enough.
Ruthie, you were fine, so you have to sleep on here. You don't have enough tokens to buy your bed.
Yes, I do.
No, let's get up.
Okay, well, I get up. I'll get up and then.
This patient hasn't earned enough tokens for a bed, and the only bed she can have for free is a cot. Right now, she's a little stubborn and confused. The nurse will explain and re-explain until she understands.
But tonight, just see, sir, you can't sleep on the bed.
I'm not sticking here.
Okay, but you can't have the bed.
Well, that's all right, too.
We found in the past in this program that no patient has to sleep for any more than 1 or 2 days on a cot under those conditions, because the tokens then acquire their value, and the patient learns that it's very easy to earn them, and does so.
Silver, you're going to stand better, you're going to get up without crying.
Do I have to go to work this afternoon?
Are you supposed to be at work?
Yes.
You better get up and go. You have to pay 3 tokens if you stay on the bed.
Oh.
What you going to do? Okay, thank you.
Cigarettes are a powerful reinforcer. Patients must learn by them. Some patients work very hard on their behavior to earn the use of our smoking room. This is one of our social learning groups where we get together and talk with patients. Their verbal behavior during these sessions give us a good clue to their progress. A patient doesn't get a token just for talking about her problems. She's rewarded only when she says something that shows she's actually trying to deal with them.
Perhaps it would help the people know you a little better if you told us a little bit about yourself this morning.
If my family had more knowledge, they would understand it better. Break a leg, a medical doctor sees it gets well. But if you have a mental breakdown, you yourself are the one that needs to help yourself more than anyone else.
Well, in about 2 weeks, I'm going to a family care home in San Bernardino, and there will be 4 girls at this family care home, and they have a swimming pool, and we'll let the patients use the pool. And after I get acquainted with the home and the family caretakers, I plan to get work.
It's a little early to say what a research project like this will mean in terms of the rest of our hospital will get along in the community. Still, we have seen that behavior can be changed for the better through our reinforcement program, and we are planning to keep on looking for ways to improve it.